Hey guys, welcome back to another episode of Ask Dr. Nick. Again, my name is Dr. Nick Schmidlkoffer, and I work for the Neurologic Wellness Institute here in downtown Chicago. And today's episode is going to be the question of what is the true cause of depression? And the reason why I want to talk about this is because depression is the leading cause of disability worldwide. And we really need better strategies in order to improve depressive symptoms and actually get rid of depression in people around our world. And so I really want to show you this one article. It's a brand new article from 2019 from the Journal of Neuroimmunology. And so here it is, Journal of Neuroimmunology, or Journal of Neuroinflammation. And what is the role of inflammation in depression relapse? So this article is mostly talking about relapses of depression. So basically not just one depressive episode, but how is inflammation present in depression relapse, where it's constantly coming back. And so we're just going to kind of slowly make it through this article, and we're going to talk about how inflammation may be the true cause of depression and then depression relapse. So right away here in the abstract, they talk about how major depressive disorder is the leading cause of disability worldwide, just as I mentioned. And generally after a first episode, patients with MDD or major depressive disorder have a 60% chance of experiencing a second episode, which is pretty high. Generally, this shouldn't necessarily happen. First-line treatments are not very effective, as we like to think, and therefore, if first-line treatments aren't very effective, there has to be something else going on. This paper is pointing to inflammation being the issue here. So it talks about how inflammation can be translated into the clinical features of depression and having those problems with ruminating thoughts, impaired mood, impaired cognition. But then also it talks about, the paper is going to talk about how inflammation could affect brain circuits that can bring about these problems and these symptoms. So let's kind of go through here. I want to start just with this graphic here. And so generally people are in a normal state and they are healthy, and they can kind of go into a down state and then back and forth into a normal state. And this is a healthy remission, healthy back and forth lifestyle. We have stressful events that cause us to feel a little down, and then we come back to a more normal state. On this side, we have where it comes into more of depression, where we have a normal state, a stressful event takes us into a down state, and we stay there. We have this relapse of depression. And then this is where that multiple episodes can cause just this loop. Okay. So first I want to talk about just the theories or the hypotheses of depression and what causes it. And so in the past, the monoamine-depletion hypothesis was the original main viewpoint on what causes depression. Basically, it says there's an imbalance between different neurotransmitters. Neurotransmitters are neuro being brain, transmitters being transmission between neurons. And so these neurotransmitters allow good communication within our brain. And so an imbalance between these communicators in the brain, possibly serotonin, which is typically the happy neurotransmitter, and noradrenergic, which could be either noradrenaline or norepinephrine, that kind of gives us a little bit of alert state. And then dopamine is another monoamine transporter, which is more for like reward and movement. And so there's an imbalance between these neurotransmitters that is like the proposed hypothesis. And this led to a bunch of, led to doctors now supplying a lot of serotonin reuptake inhibitors, which basically bring serotonin to a point where it does not get reuptake back into the cell, but it stays outside the cell, and therefore it can produce more effects. If there's not enough serotonin, then we bring serotonin up with the serotonin reuptake inhibitor. And that's what a lot of antidepressants do. Now, at the same time, this doesn't fully explain how we get these remissions. So lately here it says over the past 2 decades, there has been another hypothesis, the inflammatory hypothesis. The inflammatory hypothesis is basically that chronic inflammation may contribute to this dysfunction of serotonin, noradrenaline, and dopamine. And if we have chronic inflammation, this can lead to poor pathway connections and therefore not allowing proper release of these neurotransmitters. And that's what can contribute to depression. If it was just the monoamine depletion hypothesis, then these medications would work and people wouldn't necessarily have such a high prevalence of remission, that 60% remission. So with this inflammatory hypothesis, we have multiple papers that show that inflammation can be a role. And most of these are really just looking at relapse in major depressive disorder or progression of major depressive disorder. But here we can see like increased levels of cytokines. Cytokines are in inflammation, can lead to relapse. Increased activity of cortisol, that stress hormone, which leads to inflammation. Higher levels of IL-6 and C-reactive protein, again, more cytokines that are promoted in inflammation. Increased inflammatory activity. Intestinal microbes, so intestinal microbes being that we have an infection in our gut, which can lead to inflammation. And then here are just a couple points on treatment. So cognitive behavioral therapy can promote improvements in inflammatory responses and vagus nerve stimulation. So, and then here's another one just on straight inflammation, can lead to anhedonia and motor retardation. Anhedonia is just that like down feeling. So just a summary of some points. Now we'll kind of take it down a little bit farther and I want to show another graphic right here. So why does inflammation cause depression? Well, there's a couple factors, whether it has to do with just dealing with the brain or dealing with our brain-gut axis. So first, we're going to talk about the brain. And so we have a couple major areas here within our brain, and I'll just briefly talk about them. We have the anterior default mode network here in the frontal lobe, and the posterior default mode network here in the occipital lobe, and so occipital parietal lobe. And so both of these areas, the default mode network is most commonly active when we're our resting state. Kind of gives us our basis tone of in our brain. And then we have the central executive network, which is more active when we are making executive decisions, we're thinking, where our brain is active at work. Then the salience network here is more common. This is part of the limbic system, and it is highly active when it comes to our emotional processing. Okay? And so each of these are connected. You can see there's a green, a dashed bluish purple line, and then a red line. Each of these are connected by axons. And so these axons are connecting the different cellular regions here in the brain, or the neuronal regions. And these axons need to have good firing, good fast communication to work properly. And so if we have inflammation, inflammation damages these connections, damages the fatty insulation, just like that wraps around a cord that connects your TV to the outlet in the wall, that tight insulation, and therefore allows for proper transmission between these areas. And so inflammation can start breaking these areas and messing with the communications that don't work as smoothly. And so here down in the caption, they have segregation of the anterior and posterior default mode network, which are these two here, could be an indicator of recurrent depression. And so if these aren't communicating well, could be an indicator of recurrent depression. Then another one, increased connectivity between the anterior default mode network and the salience network can also be an early sign of depression. So if you have too many connections here that are not necessarily working well with the other regions of the brain, that can be an early sign here of depression. And then at the same time, decreased functional connectivity between the posterior default mode network and that central executive network can also be unique to this relapse. And so if we're breaking connections in any of these areas due to inflammation, and then therefore we're not getting the proper levels of serotonin, dopamine, and norepinephrine into our brain, this can all lead to those clinical symptoms of depression. So we just talked about the brain. Now we can look a little bit into that gut, okay? And so the brain-gut axis is a pretty well-known pathway within the brain and within our body, and there's constant communication between our brain and our gut. And so because our gut has a lot of gut microbiota or gut bacteria that help supply not only a way of our immune system to prevent stress, but also they supply and secrete neurotransmitters. They secrete serotonin, they secrete norepinephrine, they secrete dopamine. But the most common one is serotonin. There's actually more serotonin produced in your gut than it is in your brain. And so there's this constant communication, possibly serotonin being released up into your brain. And so again, if we don't have a good pathway that is connecting these two, then we're not going to get more serotonin into the brain. And this pathway can be affected by inflammation. So the main part of this pathway here is the vagus nerve. The vagus nerve is also called the wandering nerve because it wanders all the way from about right here at the lower brainstem, all the way down to every part of your gut, except maybe just the last part of this colon here. And so the vagus nerve has information coming from the gut up to the brain, which is most of it, but it also has information coming from the brain to the gut. And the vagus nerve can help modulate inflammation. And so if you have poor digestion, if you aren't eating inflammatory foods, if you are not treating your gut well, this can cause inflammation here and put more stress on this vagus nerve. At the same time, your gut microbiota, these bacteria should be helping you. They should be releasing serotonin, giving serotonin into the brain. And sometimes what happens is if there's not a good balance of the microbiome, then we're not getting a good amount of serotonin and those happy hormones into the brain. So therefore, this is how inflammation in the gut can affect inflammation in the brain. On this side is the HPA axis. This is how stress or cortisol can increase inflammation or affect the gut microbiome. We're just going to kind of not talk too much about that one here. I just really wanted to talk about how that inflammation in the gut can lead to inflammation in the brain. And that leads to these activated microglial cells, which are the main immune cell of the brain. So with that being said, what can we do to help promote or help decrease inflammation in the brain, and therefore help prevent depression, help prevent major depressive disorder, and therefore relapse in depression? The biggest thing we can do is check out our diet and make sure that we're not eating inflammatory foods, whether that be gluten or possibly dairy if you react to it. We're staying away from our 3 major food groups that can cause inflammation, and that especially gut inflammation. That is processed carbs, refined grains, processed sugars, and then processed oils or vegetable oils. And if we're staying away from those 60% of the standard American diet, that should help with our inflammatory processes and decrease that overall inflammation. Other things we can do is take fish oil and a lot of other factors that can help decrease our inflammation. But diet for sure is the number one that we want to look into. If, for instance, let's say that you have depression right now and you're on a SSRI or you're on a medication and you're doing great. And I'm saying perfect, stay on it, stay with your doctor, do what you're doing. But maybe if things aren't going as well and you still get these rebounds of depression, maybe we have to look somewhere else. Maybe we have to look into your diet or into other factors. And so that's just something to look into, and maybe to talk to your doctor about other ways that you can improve your quality of life and improve the effectiveness of your current medication. So that's all we got here for today. And Thanks for tuning in to Ask Dr. Nick. If you have any questions or concerns, please let me know. If you have any suggestions for future episodes, again, please let me know. I'm down to answering any or all of your questions. Just please leave a comment below and be well, stay healthy.